Dear friends, welcome to the show Talk with Your Doc. Today, our guest is Dr. Ahmed. Dr. Zaki is Chief of Staff at Thunder Bay Regional Health Science Center, and he is currently heading the unit which is looking after COVID-19 crisis in Thunder Bay, as well as he is helping in the region. I am the host today for Talk with Your Doc show at Shaw TV. My name is Dr. Prashant. Now, as we are observing social distancing, we usually have this show recorded in the studio, but we are doing this show over the WebEx meeting. And if there are any deficiencies in this recording, please forgive us. Thank you, Zaki, for giving your valuable time to us.
No, thank you for that.
Thank you. So you can hear me clearly, right, Zaki?
Yes.
Yes. Okay, we all can hear you. And as we see, number of cases are increasing everywhere in Canada as well as across the globe. And many of us sometimes have some or other symptoms. You know, somebody has a fever, somebody has cough or sore throat, and everybody is worried about, did I get this infection? Am I the patient of the COVID-19? So to relieve the anxiety of those patients, we will talk about some of the signs and symptoms, and you can contribute, I will contribute on my end also, and see how we can help community at a large to relieve their anxiety of COVID-19 happening with them or with their family. So there are few important signs and symptoms. One of them is shortness of breath. So can you please tell us about shortness of breath in the COVID-19 patient? What happens exactly?
Yeah, so shortness of breath is the one symptom that we worry about the most. So I know you've all heard of different symptoms that people have. Fever, some people have cough. You may have heard of people losing their sense of taste, sense of smell. So those are all the symptoms. But the one that worries us the most is someone being short of breath. And shortness of breath is where you were able to do activities of daily living. So you were able to get up in the morning, go downstairs, do your laundry, go outside for a walk, walking the dog around the block, and you're okay with that. But when you start feeling short of breath, you are unable to do those activities. And when that happens, that is usually a warning sign. And that is by far the most important warning sign to heed to. That tells you that there's something significantly wrong. And this could be your lungs that could be wrong, that could not be working well. This could be your heart that's not working well. And both of these could be involved in COVID-19.
So it can occur without cough also, right? So somebody doesn't have a cough but have a shortness of breath.
Yeah, usually it is. You do have some cough, but it's so minimal that you may not have even noticed it. And it may come on days before the shortness of breath comes on. So you may have a cough, which went away, but down the road you may start getting more short of breath, which is could be signs that your oxygen levels are low.
So it's an emergency sign, worrisome sign. So what should one do? Call 911 right away, go to the hospital? What should one do?
Yeah, if someone is short of breath, then that's the time when you should be going to the hospital. And really depending on what your symptoms are and how you're feeling, if you're feeling lightheaded and dizzy and unable to keep up with a conversation, those are signs that your oxygen levels are significantly low, and then you should not drive yourself to the hospital.
Mm-hmm.
That's a time when you either have someone take you to the hospital, or if the condition's really bad, you make sure you call 911. When you do call 911, make sure that you let them know that you're feeling short of breath. If you've had other symptoms, those are really important for the emergency medical services to know, paramedics to know, so that they are prepared and protected from COVID-19 as well.
Correct. Now, another symptom which commonly is found in the COVID-19 patient is fever. Can you please tell us about fever? Like many of us get some or other flu-like symptoms sometimes. When should we think about that fever as a serious one?
Yeah, so fever, and the virus has changed quite a bit. So if you look at the Chinese literature that came out from their experience and dealing with COVID-19, people often find that fever was a very predominant symptom. So that means that about 80 to 90, up to 98% in some studies suggested that fever was the number one symptom. As the disease is continuing to move west, it is mutated, and the way people present is different. Where some people may not develop a fever at all. In some of the U.S. Studies that are coming out, and looking at our own data, so looking at the fact that we've had a few cases in Thunder Bay, when we look at it, there's a majority of them do not have fevers. So only about 40% of the people had fevers that tested positive for COVID-19. When you do have a fever, it could be a spiking and remitting fever. So you may have fever at one part of the day and then go away at another part of the day. You may have a fever that just goes on and just would not resolve, or you may have a fever and it goes away fairly quickly. So it's a very variable presentation.
Most of these signs and symptoms, which we are going to talk more and more, we are still in the phase of studying about them, and we don't know exactly what happens at what time. But usually, is it that between 2 to 14 days, a patient may get any of these symptoms, or they can get it earlier also or afterwards also?
Yeah, so it's quite interesting. So as you said, we're studying it. We're learning about this disease every single day. So through 2-3 times a day, I'm looking at my Twitter feeds where the different docs around the world who are sending out Twitter feeds with all the recent studies that are coming out, so that the rest of us don't always have to stay on top of it. But that suggests that there's a lot of variance in terms of how people present and how quickly they improve. But majority of the time, what we're seeing is that once you get exposed to the virus, you start displaying some kind of symptoms or are infectious in about 3 to 5 days.
Normally, also our body temperature varies like 1 or 2 degrees here and there. So, what is the temperature at which we should worry and contact doctor?
Yeah, it's as you said. I mean, even as in the normal time that we wake up in the morning to the time when we go to bed, and then even during the night, our temperature varies quite a bit. So up to about 1 to 1.5 degrees Celsius will be the normal variance in temperature. So it can go anywhere between 98.6, which is the normal, between 37 degrees, which is usually our temperature, so 36.8. It can go anywhere up to 37.5, and down 35 degrees. Whereas if it starts going above 38 degrees, I think that's a reasonable time to think that you have a fever. And if it drops below 35, that's also worrisome.
So that is about 100 degrees Fahrenheit or more, we should worry about it probably.
Correct.
Yeah. Another symptom of COVID-19 is cough. Now, normally also we may get little tickle in the throat or some sort of clearing of the throat, and we might get some sort of cough here and there. But when is the cough serious, or when should we consult a doctor?
Yeah, so as you said, some of us will often have a cough, and there's multiple different reasons for cough. So those of us who smoke, you'll often have a smoker's cough in the morning. People with asthma, people with gastroesophageal reflux disease, people with the postnasal drip, they'll often have coughs in the morning. And those are not the coughs that we usually worry about. When we start worrying is when it's a new cough, when it's a cough that you've never really had before, and all of a sudden you start coughing. When a cough that's persisting, so it's persisting for more than a day, and not just in the morning, but continue on through the day, that's when it becomes worrisome enough that you should seek help.
So persistent cough, and is it a dry cough, or is it with the sputum, or how does that cough look like?
Yeah, so often it's dry cough. So you will often have a dry cough that is not productive of a lot of sputum. But what we found in COVID-19, again, there's just so many variations that people may have productive cough as well.
So it's a bothersome deep cough which may or may not be productive. We should consult doctor then.
Correct.
Another symptom of COVID-19 patients is chills, body aches. Some people with mild flu-like symptoms also do have chills or fever or body ache. So how do we know whether it is COVID-19 or something else?
Yeah, and COVID-19 is being called the great mimicker because of the fact that it presents like any other viral illness and all the different viral illnesses. So you may have symptoms, as you said, of myalgias, of very high spiking fevers, or chills, what people say. And those are some of the things that we have seen along with other viral mimickers. So you may have conjunctivitis, which is the redness in the eyes. You may have runny nose, which could be with other viruses as well. You may have symptoms like diarrhea, which is usually not a part of a coronavirus-like infection. So it's very odd to see the diarrhea, the persistent diarrhea that you can get with COVID symptoms. Some of the things that we've seen are that the virus can attack the brain. So you may have the people present with sudden confusion, people who may present with seizures, people who may present with acute onset of what we call delirium, or even psychosis.
So chills and body ache, for example, the symptom which we are talking now is people can get with a flu-like symptom, but then we should worry about it if the chills or body ache doesn't go away or worsens after a certain time, and it persists for a longer time. Is that true?
Yeah, I mean, anytime it's going over, I mean, the general rule is 24 hours. So if it's going over 24 hours, that's the time when you should be, and it's not going away. That's the time to make sure you call the district public health unit or the Ontario Health.
One of the symptoms you mentioned here just now is the confusion, and I have heard that this sudden confusion, if you develop, it's like an emergency sign. So please tell us about what is this sudden confusion? How does it develop in the patients with COVID-19?
Yeah, so I mean, I think confusion's one that we really need to pay attention to, simply because sometimes confusion may be part of a more sinister condition like a stroke, where we can do something. So if it's coming on with symptoms like facial droop, with arm weakness, or with speech difficulties, then you should be calling 911 right away. So this is the time when you do not wait for 24 hours. It's really, really important that you get to the hospital right away. So we don't want to miss stroke in these patients. In patients with COVID, what you can have, and there's different case reports of people presenting with symptoms that they've never had before, so where they're not recognizing people or they're speaking oddly. So if your family member is displaying those symptoms, that may be a sign that they may have COVID.
You mentioned about diarrhea in the patients with COVID-19 patients. Is it something which is new, or somebody can have just diarrhea without fever, chills, cough, and patients with COVID-19 just can have loose motions or diarrhea, or how does this happen?
Yeah, so the diarrhea is one that has been described more than the other. So confusion is actually a very rare one, but diarrhea has been described a lot more, where similar to other viruses like the rotavirus or the Norwalk virus, which usually causes diarrhea, and it's a usually loose, watery diarrhea. This one may be accompanied by fevers, which is the typical presentation of other bacterial diarrheas. So this one would have similar symptoms, but when we check for COVID-19, they're usually positive.
So those patients with just diarrhea when should they contact doctor?
Yeah, so the Public Health Ontario has now broadened their swabs or their testing that they want to do. So we really want to make sure in order to stop the spread of COVID-19, that we really identify patients who have COVID-19 very early, so to minimize the spread. We do know, so there was a study that came out in Nature Medicine on April 15th, where they talked about having about half of the people that got infected with COVID-19 were infected by people before they started showing symptoms. So it's extremely important that as soon as you start showing symptoms, even though you may have already started infecting, we move quickly in order to make sure that you don't have further spread. So calling your district public health unit or calling telehealth would be a very good way to go.
Another symptoms you just mentioned before was pink eye or conjunctivitis, and some patients also have a fatigue, extreme fatigue because of this COVID-19. So how long this fatigue lasts? It happens just after, or it stays even longer after the infection subsides?
Yeah, so fatigue is one that's fairly subjective. So how tired you are is really dependent on you, right? So if you've only slept 4 or 5 hours, or your baby was up at the middle of the night and you have to get up multiple times, you will have some tiredness. So this is usually the unexplained tiredness that we worry about, which is the fatigue, where you're just too tired to do things. This may be a sign of COVID-19, although it could be very much be other things that as well. And in those cases, that could be prolonged in COVID-19. So even after you've gotten better from COVID-19, some people say that they're fatigued for quite a few weeks even after you've gotten better.
One of the study WHO report I read, where they say that about 14% of the COVID-19 patients in China, out of those 6,000 patients they studied, had some sort of a headache, sore throat, some sort of a nasal congestion. I mean, COVID-19 has a lot of variable presentations, but some of the signs and symptoms are really worrisome, and one should contact the doctor, like sudden shortness of breath, syncopal or confusion. Anything else you would like to say about worrisome signs and symptoms? Like if we say severe breathlessness or severe cough, or we talked about confusion. Anything else you would like to add to the serious symptoms of COVID-19?
No, I think those are what you just mentioned was if you've got severe shortness of breath or you've got sudden confusion, that is the time not to wait. So there's two different categories. So there's times where you could wait for a few hours to see if you get better. So if you've got a runny nose and itchy eyes when you wake up in the morning, it could just be your allergies. So especially in this time of the year, take your allergy pill. If it hasn't gone away, that's when you call. So similarly, if you've got diarrhea one time, you may want to wait and see how things go. However, if you have shortness of breath, if you have sudden confusion, those are the times when you need to call 911 and make sure that you let them know what the symptoms are, so that they can bring you into the ambulance, because they could be representative of things that we can fix fairly quickly, especially confusion and strokes.
If the patient is young with a mild flu-like symptoms or body ache or cough or pink eye or something like that, they can wait at home till like 24, 48 hours or something like that. But if patient is like say above 60 or immunocompromised, or somebody has hypertension or associated comorbidities, should they wait or they should go to the doctor right away?
Yeah, so I mean, right in this time of the COVID-19, we actually recommend not going to a physician. However, you should call them. You should call your physician, and most of the physicians currently are being working what's called remotely, so they're contacting, so you're available by phone They can call you back. They can assess over the phone what your symptoms are, what your medical history, and they can make a decision as to whether you need to come to the hospital, whether you need to call your district public health unit, or whether you're fine to just wait at home.
Um, so now coming to the guidelines for the testing of the COVID-19 disease, what is current strategy at Thunderbay Regional for testing COVID-19 patients? Who are tested? Who is given a priority number one, priority number two? Is there any priorities like this for the COVID-19 testing?
Yeah, so the COVID-19 testing has been changing every day. So what I'm going to tell you today may be different than when this is aired and when the information becomes available. So today, as of today, we are starting to do what's called surveillance screening. And what surveillance screening is that we have identified enough of the people that have had symptoms. So we initially started off with very strict criteria where you had to have fever, you had to have travel, you had to have shortness of breath, you had to have a cough, you had to have contact. So that's what we started off with. And then we went on to expanding it a little bit more. So if you were a healthcare worker, if you lived in a long-term care, if you were in an institution, if you were from an indigenous community, those are the places that we started started to test a lot more. And now, as of today, what we're doing is we are testing what's called surveillance. So we want to make sure that if you have any symptoms, so any of those symptoms that we've talked about, that we would want to make sure that you're tested. As I said, it really helps to limit the exposure of other people. So if you have symptoms like a cough, shortness of breath, fever, if you have chills, body aches or myalgias, if you have a runny nose, fatigue, headaches, sore throat, any gastrointestinal symptoms, so if you have lots of nausea, vomiting, if you have diarrhea, those are a sudden confusion. So any of those things that you may have, we would test you at our assessment center.
So how long a test result takes usually?
So right now it takes a few days. So the way the process would work is that you would call the Thunder Bay District Public Health Unit, and they would make an appointment to come into the assessment center. The assessment center is located, the COVID-19 assessment center is located right on our property, right outside the emergency room. So they would make you an appointment to come over there. You would come in and they would put a Q-tip in your nose. The nose is the part where the virus grows the most. They would put in that swab, send that off to, right now to Toronto, where we're trying to get our local testing done. But the swab gets sent out, and then we should have results in the next few days. However, what we're trying to do is to get local testing, which should be able to give us answers within a few hours.
So once, say, COVID test is positive, what should one do? What is the recommendation at this time for the patients with COVID-19 positive patients? Test is positive.
So before I talk about what to do for positives, I would like to go over what to do after you've had symptoms. So once you've had symptoms and you came in for your testing and you're waiting for those testing, you should continue to self-isolate. So which is you stay away from going outside, even if you're living at home, staying away from the rest of your family members, because it becomes really important not to make sure that you don't infect others. So if you're at home, stay in a separate room. Don't share things like beddings. Don't share things like spoons and knives and forks. Don't share your cutlery. Don't even things like remote controls, door handles. Those are great ways of spreading infections to your family. So stay away from that. And then wait for the test. If you start feeling short of breath during any of the time, that's the time when to call either the telehealth or to come to the emergency room. And if your test does come back positive, you continue to do the exact same thing. So nothing's really changed. You continue to do what you were doing. Usually from the onset of symptoms, you're still infective being that you can still infect others for about 14 days from the onset of symptoms. So that's the really crucial time to make sure that you're staying away from people.
So covering the mask, covering the face, and covering your cough or sneezing, all those are, as you said, are very important things. Clean the touch surfaces, which are commonly used, like as you said, remote control or door handles or desk or anything where you touch commonly, and stay away from the family. That's very, very important instructions. And how long one has to stay in the quarantine or isolation? Is that 2 weeks or 3 weeks? How long is that recommended at this time?
So we still recommend 2 weeks, so 14 days, because we know. Most of the time you're really infectious between 5 and 10 days. However, we know that by 14 days, most people, so about 95% of the people, do not spread any more germs. If you're still symptomatic, so if you still have the persistent cough, which could go on for a while, you may want to keep yourself away. Frequent hand hygiene, so make sure that you're washing your hands frequently, is the best way to prevent and to avoid infection from spreading. The other thing to do is to cover your cough. So coughing in your arm rather than in your hand, and being able to cover your sneeze, using Kleenexes and then disposing of them properly. Those are all very good measures to make sure that you're not spreading infection.
Yes. So once the patient is positive, say for example, test is positive, he has all the symptoms, he has quarantined himself for 14 days, then how do you come out of it? How do you de-quarantine yourself? Is there any protocol for that?
Yeah, so we used to think that once you're infected, you're not going to get infected again. There are some case reports now, especially coming out of South Korea, which suggest that you may still be prone to developing an infection again, and that has to do with the virus mutating. So the virus that your body developed an immune response to may not be the same virus that you get infected with again. So as a result, you may still have a risk of an infection. So it's always better to continue maintaining your physical distancing, even when your self-isolation period is over. Just because your self-isolation period is over doesn't mean that you start going into having parties and people at your house and socializing. It's not something that you want to do because you can get infected again. So I would say be very careful when you're coming out of the self-isolation.
And again, wash your hands, cover your mask, avoid social distancing, cleaning the surfaces, all those things, and then monitor your symptoms, right? Sometimes it may come back and you might be worsening probably.
Yeah, and as I said before, I think it's really important to remember that your initial symptoms may resolve fairly quickly. So if you had cough and a runny nose and fevers before, and it goes away, you may still develop the lung disease going forward. So being very mindful of those symptoms.
Do these patients who are COVID-19 test positive after their recovery of symptoms, do they need another test to make sure they are recovered, or how does that happen?
Yeah, so we don't do that at this point, although there are studies being done looking at blood tests, which look at antibodies in your blood. They're still being worked on, and we're supposed to have some of those testing done fairly quickly. That tells us that you have antibodies to that one virus. And as I said before, you may not get infected with the same virus again. So you're still at risk for developing COVID.
So now, for somebody who has symptoms and his or her COVID-19 test is negative, What does that mean, and what are the precautions to be taken in that case? Can the test become positive at a later date?
Yeah, so absolutely. I think that's a really important question, and that's the one area that we're still learning a lot about. So when you do have COVID-19 testing done and it's negative, it could very well be one of those multitude of other viruses that we've had around for a long, long time. So for those, we recommend that you continue to watch yourself to make sure your symptoms resolve. Once your symptoms resolve, you should be able to get back into doing things that you were doing. However, you are still, just because your test is being negative doesn't mean you can't get infected. So the test, even when it's negative, has a percentage of people that it may not be positive in. So at the time, you may not have enough viral load in your nose for it to be positive. The test may not have reached the right area for your nose just because you moved back, things like that.
Mm-hmm.
Or you may not have had the virus at that time, but you may have developed the virus a couple weeks later. So those are the things that just because it's negative once doesn't mean that you're safe.
Yes. Going back to the basics of how the COVID spreads from one person to another, and one of the way it spreads is like respiratory droplets. Somebody sneezes or coughs, and those droplets transfer, and that's why we recommend 6 feet or 2 meters of distance, and covering the face with a mask. Now, can you please tell us about the role of mask in the prevention of the spread of COVID? Like, should everybody wear the mask, or only people who are infected should wear a mask? What is the current recommendation?
Yeah, so one of the things that you'll hear everyone say is that we're still learning about the disease. And what we started off with knowing generally about masks was that they may not help prevent you from getting the infection. But what we know now is that it may actually help avoid you infecting others, and especially when I said when half the people will get infected when you yourself don't have symptoms. You'll develop it later, but even before you start developing symptoms, you become quite infected and you're spread it to other people. So this is where the masks become really, really important, is in that what's called a pre-symptomatic phase. So if you have the mask on during that time, you may actually protect others around you from getting infected. So it's really important to make sure that you wear a mask. And when I say a mask, there's lots of ideas compared to wearing cloth masks. And a cloth mask to prevent others from getting infected is just as good. And avoid wearing things like N95 masks and surgical masks. Leave those for healthcare providers where they're at higher risk for developing infections. For you to prevent that infection from spreading, the cloth mask is just as good.
Another way the virus spreads is through the contaminated surfaces. So cleaning these surfaces is very, very important. And hand hygiene, as you recommended that one should wash their hands very frequently with sanitizer or alcohol-based cleaning agent. Now, treatment aspect of COVID-19 positive patients. What sort of treatment is available at this time for the patients?
Yeah, so I know there's been a lot of hype about certain treatments. So we have to be careful of it, how those treatments are being done. Initially, there was a lot of evidence or a lot of hype about hydroxychloroquine and chloroquine and azithromycin. And a recent study that just came out of France actually showed us, so when they actually divided what the original studies were, that when you took these, you got better. But they gave it to everyone, and some people got better, some people didn't. Then they divided, what they started doing was clinical trials. So they gave half the people the medication and half the people they didn't give the medication to, so hydroxychloroquine, azithromycin. And what they found just recently in France was that the people who were taking hydroxychloroquine and azithromycin did slightly worse than the people who were not given that medication. Suggesting, and there was a lot of complications with heart rhythms, things like that. So this is why it's really important not to start trialing something just because without a good clinical trial. So right now, there's no proven treatments for COVID-19. We have now moved away from using hydroxychloroquine and azithromycin, both for preventative as well as for treatment. There are other trials that are going on, and most of the time you'll be asked to be part of a clinical trial. And if you're being part of the clinical trial, you're helping with the science.
How about vaccine? What is the update on the vaccine at this time?
Yeah, so they've started human trials for the vaccine. So as you know, vaccines have a lot of trials that they have to go through. So they have to make sure that you prove that they work against the virus. And secondly, you have to prove that they're safe in human beings without any side effects. And then they develop enough immune system in the body to fight that infection. So those are 3 different steps. So right now we've gone from the step of it being effective. So now we have an effective vaccine that's in the lab. Now what we've gone to is just trying to see if it's safe in human beings. Once we know that it's safe in human beings, then we can start exposing those humans to the virus and try to see if it's effective. And so right now we're at that point where we're just testing for safety.
So we are still about 6 to 8 months away probably from real vaccine appearing in the market.
Absolutely. And I think that's, so trying to depend on a vaccine to get us out of this is going to be a hard thing. The only thing that's really going to help us get out of the current situation is making sure that we continue physical distancing, continue washing our hands. When we have any symptoms, making sure that we isolate ourselves. Those are the most important things.
Last question for you is about children. A lot of families with young children, what should they do for the children? Are the children more susceptible or they are less susceptible? What should we instruct to the children at home?
Yeah, so very interesting question, and I think all of us worry about children first. But surprisingly, like most respiratory viruses, children are fairly strong with it, and they don't develop as many symptoms with respiratory viruses. So they will have the occasional cough, and they get better. They don't have the complicating diseases that we see in adults. So they won't have the typical lung diseases, things like that. So even if the kids do get exposed to it and they do get infected with it, in some of the data, it suggests that they're very low risk for getting the disease. However, they're very good because of the fact that they don't develop a lot of symptoms. They're very good conductors of the disease. So they will go in and pick it up and then give it to someone else. So it's really important to have that, especially if you have elderly in the home, to making sure that the kids stay away and the kids wash their hands. So the same precautions that you would do for yourself, make sure the kids wash their hands, keep hand hygiene, cough in their arms. All those things are really, really important.
So the kids would have the similar symptoms as the adults, or they would have like a certain symptoms more, certain less, or do you know anything about that?
Yeah, they usually have similar symptoms and much milder than adults would. So sometimes you may not even know that the kid got sick and got better, and that's how mild the symptoms are.
Is the loose motion a common symptom in children with COVID-19 positivity?
No, the cough is still the number one symptom, so the respiratory symptoms are still there, but you may have diarrhea at times, similar to adults.
Right. So to conclude this discussion, keep safe distance of 6 feet or 2 meters away. Wash your hands frequently with soap and water or alcohol-based sanitizer or any other solution which cleans your hands. Cover your face with a mask. Anything else would you like to say?
Yeah, no, I think you said it at home. Stay at home as much as possible. Avoid contact with others. And making sure you keep your good hand hygiene. Those are by far the most important thing.
Thank you, Dr. Ahmed, for your valuable time. Really appreciate it.
No, thank you to your viewers for watching this. Thank you.
Thank you.